Murkowski.
Thank you, Mr. Chairman. I'd like to speak to the issue of suicide. We were in appropriations, defense appropriations yesterday, talking about the impact of suicide on our military. Some staggering numbers. I think we recognize that this is an issue within our military that we care deeply about. Another sector that we are seeing some staggering numbers is as it relates to American Indians and Alaska Natives. Unfortunately, our statistics there are really quite troubling. The rate of suicide for American Indians and Alaska Natives is 70% higher than for any other ethnic group in the United States. And then when we look to the youth suicide statistics, that rate is even higher. On some reservations, we have youth suicide rates that are 10 times the national average. Again, the young people seem to be hit the hardest with this. The rates that are highest are those that are between ages 15 and 24. Young people in this age group make up 40% of all the suicides in Indian country. Staggering statistics. In my state, we've got 10 people on average who commit suicide every month. 78% of those suicides are committed by young men. Troubling statistics that need attention, need focus. We have to do what we can to provide our states and our tribal communities with the resources that they need to work to prevent the tragedy of suicide. I think we would all recognize that one death is too many, and many of these are preventable. So what do? SAMHSA grants help to improve behavioral health in our tribal and our village communities. SAMHSA Tribal Affairs has a special focus on American Indian and Alaska Native youth suicide and substance abuse prevention. What they do within SAMHSA is engage the tribes, the federal agencies, the national, regional, American Indian and Alaska Native organization, the states, the behavioral health providers, and they work to engage all collaboratively to help mitigate some of the social and economic factors that we're dealing with here. I think we see consistently that their grant programs show signs of success. They are making a difference. What I am proposing in my amendment is to increase SAMHSA's suicide prevention initiative by $10 million. I'm doing this by a corresponding reduction to the Center for Medicare and Medicaid Services program operations. They receive an increase in this bill of $547 million. This is compared to FY12. What we're looking at here with the $10 million that we would redirect to the SAMHSA suicide prevention, I think it can make a difference for Alaska Native and American Indian communities. CBO has looked at this amendment. They have scored it and says that it will save $5 million in this next year compared to the underlying bill. When we look to taking money from one pot to another, I know that there is a sensitivity, as the chairman of the Help Committee points out, it will have impact in other areas. But I think given the increase that the Center for Medicare and Medicaid Services program has received, that, I mean, they've got over $3 billion allotted to CMS operations. So $10 million coming out of that, I think, is a small amount that can go a long ways to alleviating the tragedy that we see in far too many of our communities, far too many of our tribes and reservations. So I would ask for members' support of this amendment.
Mr. Chairman, if I may, as a co-sponsor of the amendment, I just want to emphasize my support for it as well. We have all of or parts of 5 different reservations in my state, and suicide on a reservation is a tremendous problem, and this would be very helpful.
Chairman,
first of all, as I read the amendment, it does not specify that they go where it goes. It just goes for SAMHSA, for suicide prevention program.
Right. Correct.
Just, right, so it doesn't target it to native populations and,
If I would direct your attention to the report language where it goes into greater detail or specificity in terms of where within SAMHSA
I
it
see you're
goes
going
for
to use
suicide.
report language, I see.
Correct.
Okay, all right.
So
Well,
that it is clear that it goes towards American Indian, Alaska Native suicide prevention.
first of all, Mr. Chairman, I just say, look, you know,
Can I catch a 440?
this is an issue that does need more attention.
I'm sure they'd be glad to proxy.
And I'd like to work with the senator from Alaska to find some money for this. But quite frankly, this takes money, and it's one of the most polarizing parts of the bill, the health care reform bill, or Affordable Care Act. I would just say to my friend from Alaska that I would like to work with her on this. I'm sure that if we did a little bit here and a little bit there and a little bit here and a little bit there, we might come up with $10 million some way without damaging too many people on this committee. But to go after the Affordable Care Act puts it in a polarizing situation, and that shouldn't be. That shouldn't be. This is an issue that all of us ought to try to support. We need more funds in SAMHSA for suicide prevention. I understand that. I wish that the senator would work with us on this. I would give the senator my absolute assurance that before this bill gets to the floor or goes into some kind of big ball of wax at the end of the year on some kind of a big appropriations bill and stuff, to find $10 million for this. But it can't come out of the Affordable Care Act. It's just too polarizing. But I'm sure that we can find something that, where I can get all the members of the committee that won't be upset about this. And we'll pull a little bit here. Like I say, we'll cobble something together where we can find $10 million. But I can't accept this amendment the way it's drafted.
If I may join you, sir, I'd like to assure the senator from Alaska that I'll do everything possible to make certain this matter is resolved. But can we set this aside until the time?
Well,
I can assure you we'll work on it.
I appreciate the assurance of both the chairman and the chairman of the authorizing committee. This is an issue that I think goes so deep to who we are as a nation. I said this earlier yesterday. As it relates to our military men and women and our suicide rates there, I think the same holds true when we're speaking about America's first peoples, our American Indians and Alaska Natives, and these suicide rates that we face are unacceptable. And we have not been able to work to reduce them. They only seem to be going up. That's not the right trend. I look at $3 billion that is directed to CMS and say asking for $10 million to come out seems like such a pittance. I appreciate and recognize that when I have the word of the chairman of the Appropriations Committee that he will work with me to assure that this is there, that sir, is as good as a positive vote, so I will accept that. I will work with not only the chairman of the Appropriations Committee, but the chairman of the Help Committee in ensuring that we do more to help address the scourge that faces our first people in this country when it comes to suicide. So I will withdraw my amendment at this time, recognizing that we will have the opportunity to address this and to provide some relief. And I thank you both.
Guarantee it.
Thank you very much.
Chairman?